For the 800,000 Oklahomans on Medicare, 2026 brings major changes you need to understand. Starting January 1st, a new rule for traditional Medicare could delay your care, prior authorization. And it's more complicated. Oklahoma is in a pilot program that will use artificial intelligence in this process. These federal policy decisions and rising costs mean the choices you make this year are more serious than ever. We're breaking down 5 things you must know: the new rules, the costs, your choices, and how to protect yourself. Let's start with your wallet. It's not all bad news. The average Medicare Advantage premium in Oklahoma is actually going down. But while some premiums are down, your initial costs for care are going up. Are you prepared for these deductibles? First, and perhaps most importantly, the Part A deductible for hospital stays is increasing to $1,736. Second, the Part D deductible for prescription drugs is rising to $615. And third, the annual out-of-pocket cap for your medications will rise to around $2,100. So you have lower monthly premiums for some plans, but higher upfront costs when you need care. This trade-off makes choosing the right plan vital. Now, let's go back to that new prior authorization rule. It's part of a program aimed at reducing waste. But how will they actually decide what gets approved? Essentially, before certain procedures, your doctor must get approval from Medicare first. This could mean delays while you wait for a decision. This isn't just a formality. It adds a new step between your doctor's recommendation and your actual care, creating a potential barrier. This is a pilot program in only 6 states, and Oklahoma is one of them. Our state's beneficiaries will be on the front lines of this change. With these new rules and costs, what are your options? The good news is you have more choices than ever before. This brings us to thing 3. Your plan options are growing. For 2026, the number of Medicare Advantage plans in Oklahoma has increased from 73 to 82. More choice doesn't have to mean more cost. Every Medicare beneficiary in Oklahoma still has access to a Medicare Advantage plan with a $0 premium. To help you sort through these 82 plans, Medicare upgraded its Plan Finder tool. It now includes doctor directories to check networks before you enroll. This brings us to thing 4. New protections. If you enroll based on an incorrect directory, you'll now get a special enrollment period to switch. So you have more plans and better tools. But let's return to that unsettling question about how prior authorizations will be decided. Here's the complicated answer: AI. Oklahoma's pilot program will use artificial intelligence to review claims, raising new questions about fairness and accuracy. This high-tech change highlights a fundamental truth. Medicare Advantage plans are not static. Your network, costs, and benefits can change every single year. Simply letting your plan auto-renew could mean you're unknowingly accepting higher copays or losing access to a trusted doctor. Passive enrollment is a risky strategy. So we have new rules, shifting costs, and more plan choices. What does this all mean for you right now? Let's connect the dots. Your upfront costs are rising. At the same time, a new AI-guided rule could create hurdles to care. This makes your choice about access, not just money. Because plans have their own authorization rules, you must weigh them against the new rules for traditional Medicare. You're not just choosing a premium, you're choosing a system. The expansion to 82 plans is your main tool to deal with this. You can actively choose a plan whose network and rules best suit your personal health needs. The core takeaway is this: the government is adding new oversight to Medicare in Oklahoma, so you must add your own oversight to your plan selection. This all leads to thing 5. Your action plan starts now. This isn't just information, it's a deadline. Medicare's open enrollment is your window to act. It begins November 1st and ends January 15th for your 2026 coverage. Step 1. Review your current plan's annual notice of change. Look for changes in costs, doctors in the network, and drug coverage. Step 2. Use the updated Medicare Plan Finder on Medicare.gov. Compare your current plan against all the new options available in Oklahoma. Step 3. Make an active choice. Don't just let your plan roll over. Decide if switching will save you money or give you better access under these new 2026 rules. The rules are changing, but knowledge gives you power. Take control of your Medicare coverage this fall to protect your health and finances in 2026.